So again, welcome everyone. Today's topic is the Medicare Annual Wellness Visit, some reminders and overview of the benefits of this program. My name is Phoebe Nelms. I'm the Associate Program Director here at Morehouse School of Medicine's National Center for Primary Care and in the Health IT Division. And joining me as my co-host today is Ashley Barfield.
Hello, everyone. Happy Valentine's Day.
Thank you so much, Ashley. So what will we talk about today? Today, we're going to talk about what are the benefits of conducting the annual wellness visit to your patients. Are there benefits for your practice and the providers? And we're going to talk about the 3 types of visits that align with the annual wellness visit program. And we're going to touch on the revenue potentials that making the effort to conduct these visits can bring to your practice. What are the benefits to patients? Well, it is completely free for patients, and because it's focused on prevention rather than intervention, patients can really use this opportunity to share their concerns, have a conversation that helps them coordinate with their physicians to develop a strategy to stay as healthy as possible for as long as possible. And as you can see on our screen, patients who do receive an annual wellness visit, they have a dramatic reduction in the total healthcare cost over the next 11 months. And they are associated with significantly reduced spending on hospital acute care and outpatient services. And I think most patients would do what they could to avoid a hospital stay. And it also encourages patients to be more involved in their wellness. So how about the benefits to the practice and to the provider? Well, more and more practices are finding that they can use the wellness care services and revenues associated with this to strengthen their infrastructure for providing comprehensive and coordinated care. A well-designed and managed annual wellness visit process, it doesn't demand a sacrifice or trade-offs from the bottom line, but actually contributes to the practice's bottom line. Providing these services can pay for themselves directly, and at the same time, position clinics to provide additional care coordination, screenings, and preventive services that can be handled in a financially sustainable manner. And of course, doing these visits and updating your patient's problem list by means of that conversation means that more patients are attributed to their correct primary care practice and are accurately risk adjusted. And both of these are very important, especially when you're trying to succeed in a program like MIPS or an alternative payment model. So we are going to talk a little bit about how some of the quality measures that you may have to report on for MIPS can be addressed actually during the annual wellness visit. As we can see from this list, there are quite a few opportunities. These are MIPS measures. As you notice, some of them have been crossed off. Why is that? It's because when I checked the 2023 list of measures, these had been removed. So although you may be conducting annual wellness visits and have your process pretty much down, you really want to check with the quality payment program inventory of measures to make sure that you're using the right measures as well as the right codes. They're a great resource for finding the applicable codes for all of these quality measures. So you may be wondering, Who in my practice can provide and bill for the annual wellness visit? Let's see. Physician, physician assistant, nurse practitioners, clinical nurse specialists, any medical professional, including a health educator, a registered dietitian, or a nutrition professional, or other licensed practitioner, or a team of medical professionals working under the direct supervision of a physician. So ideally, the practice can perform these visits without straining their current workflow, but as COVID has highlighted, there's so many staff shortages and other pressures to deal with. Many practices find this a challenge. However, they can still achieve increased revenue and gather that information that gives them deeper insight into their patient's health by outsourcing the annual wellness visit. And that's something that you can research to find a reputable third party that can help with that. So what we want to talk about next is just an overview of the overall program. Who is eligible for the annual wellness visit? The patients who are Medicare Part B enrolled, they're eligible after the first 12 months of their enrollment. Now, the annual wellness visit, there are three basically different components to it. So the first one is the IPPE, Initial Preventative Physical Exam, or the Welcome to Medicare visit. It's not a routine physical or a follow-up visit, and it has to include a personalized prevention plan services. There is no copay or deductible for the patient. And as part of this visit, a health risk assessment must be conducted. Also, you can use this service to identify patients who would benefit from a discussion about their self-management goals. And staff can really play a key role in identifying patients who might be at high risk, who could use the coordination of care and the generation of a health management plan. Use this program to risk stratify patient population. Again, that impacts the quality payment program because properly risk stratifying patients impacts your cost score. And we can also use the annual wellness visit to document diagnoses and conditions that accurately reflect the patient's severity of illness, which again goes back to properly assessing their severity of illness that impacts the cost score for the quality payment program. So we mentioned that it's not a regular annual physical. These are the characteristics of an annual physical. And again, the annual wellness visit is not the same because Medicare does not cover this. Patients would pay 100% out of pocket for an annual physical exam that meets these criteria listed here. It's designed to look for health problems. Of course, the clinician would perform the exam of the eyes, ears, nose, and throat, listen to chest sounds, test motor function and reflexes, do a pelvic and rectal exam, do measurements on height, weight, and blood pressure, assess BMI, physical exams such as a head, neck, abdomen, a neurological exam, preventative screenings such as mammogram or colonoscopy, and laboratory tests would also be included. So what's different with the annual wellness visit? We'll talk about it more in detail, but this is just a summary slide. Collecting the medical and family history, all the medications that a patient may be on, as well as a list of the providers, the different specialists that they may be seeing, of course, record their height and weight and blood pressure. So there are some things that overlap, and we'll talk more about the specifics of the annual wellness visit as we continue in our discussion. So as mentioned before, there are 3 different types of visits covered by the Medicare Annual Wellness Visit program. The first one is the IPPE, Initial Preventive Physical Exam, that we call the Welcome to Medicare exam. It's a one-time benefit, and it must be done in the first 12 months of Part B coverage. So this is all part of the eligibility screening that you would do to identify patients who qualify for each specific one of these services. And so it's a good reminder and guideline. Then we have the initial annual wellness visit. It's the first time a beneficiary receives an annual wellness visit, and it's done after the first 12 months of Part B coverage and after the IPPE. And we want to space them out so that they only occur, they don't overlap too much. And then there are the subsequent annual wellness visits. And that applies to all the annual wellness visits after their first one. And again, no overlap in time. So what are the components of the IPPE? Again, they have to be new Medicare patients within 12 months. So you want to look at your maybe your appointment and see how many new Medicare eligible patients are coming up, and give them a notification so that they can come in and start receiving this service. And it requires a review of medical and social health history and preventive services education. And again, there's no copay for the patient. What code do you use? It's G0402. There are additional codes for electrocardiogram screening that are listed along with this visit. And if you're interested, I can share them with you. I'll just give you the numbers. G0403, which should be a routine ECG with 12 leads performed as a screening for the initial preventive physical exam with interpretation and report. G0404, which would be electrocardiogram routine ECG with 12 leads tracing only without interpretation and report. And then G0405, electrocardiogram routine ECG with 12 leads, interpretation and report only, performed as a screening for the initial preventive physical exam. So you need an ICD-10 code as well, and these are recommended. Z00.0, encounter for general adult medical examination, and so on. And so all the services that CMS lists as a part of the IPPE must be provided in order to submit the claim for payment. We want to be sure that we follow all the nuances so that the claims will be accepted and paid. Very important, review the patient's medical and social history, review the patient's potential depression risk factors, including current or past experiences with depression or mood disorders. Review the patient's functional ability and safety level. Measure their height, weight, BMI, blood pressure, vision, and other factors. End of life planning, if the patient agrees to this. Review current opioid prescriptions, screen for potential substance use disorders, educate, counsel, and refer based on previous findings. Educate, counsel, and refer for other preventive services. So we see how this can be a foundation for really providing proactive care. The IPPE does not include other preventive services that are currently separately covered and paid for under Medicare Part B. That is pneumococcal influenza and hepatitis B vaccines and their administration, screening mammography, screening pap smear, screening pelvic exams, prostate cancer screening test, colorectal cancer screening test, diabetes outpatient self-management training services, bone mass measurements, glaucoma screening, medical nutrition therapy for individuals with diabetes or renal disease, cardiovascular screening blood tests, diabetes screening tests, screening ultrasound for abdominal aortic aneurysms, and so forth, since they are covered by other Medicare Part B services. So, give you guys a break from hearing me talk. A little quiz. It's not a poll. You don't have to click anything. Just let's do this in our heads. Is the IPPE the same as the initial annual wellness visit? Excellent. A brave soul put an answer in chat. Thank you. No, it is not. They're separate, different code. Since you must report a diagnosis code when submitting a claim for the IPPE, should you use the Z family of codes? Yes. Since you're not required to document a specific diagnosis code for the IPPE, you may choose any diagnosis code consistent with the beneficiary's exam. Can advanced care planning, ACP, be billed separately? Watch out. Oh, the answer is actually no. The ACP is included as a mandatory component of this visit. Tricky question, I know, I'm sorry. Are clinical laboratory tests part of the IPPE? No. The IPPE does not include any clinical laboratory tests, but you may make referrals for such tests as part of the IPPE if appropriate. So thank you all. All right, so now we move on to one of the other three kinds of annual wellness visits. This is the first annual wellness visit. It's for those patients who are no longer within the initial 12 months of their Medicare Part B coverage period and have not received an IPPE or AWV within the past 12 months. It includes a personalized prevention plan of service. And the code for that is G0439, as well as the Z codes or any other codes that are appropriate. So what's involved? The first annual wellness visit has to include the performance of a health risk assessment or HRA. And to have this go smoothly, it's great to think about the communication needs of our patients, whether English is their first language, what's their level of health literacy, and so on, to help really gather the information accurately and make the patient feel comfortable. You also want to collect demographic data, health status self-assessment, psychosocial risks such as depression, life satisfaction, stress, anger, loneliness, or social isolation, pain and fatigue. Behavioral risk, such as using tobacco, level of physical activity, nutrition, oral health, alcohol consumption, sexual health, safety at home or in driving their vehicles, such as seatbelt use. And we want to assess activities of daily living, dressing, grooming, feeding, toileting, ambulation, balance, fall risk, bathing, their ability to use a cell phone or a phone, housekeeping, laundry, shopping, managing medications, and handling finances. And also, how do they get around? What mode of transportations are they comfortably using? It also, once the health risk assessment is complete, also means that we have to establish the patient's medical and family history, establish who are their current providers, and suppliers list for maybe durable medical equipment, measure height, weight, BMI, blood pressure, vision, detect any cognitive impairment they may have, review their potential depression risk factors, and so on. And the other part to this is establishing an appropriate patient screening schedule that's written that you can share with them. So it's like setting out some goals, some considerations that you really want to work together on over the next 5 years. So that the recommendations that the clinician makes can really help the patient reach their personal goals for their health and well-being over that time span. And so this might include providing advice, personalized health advice to the patient, maybe including referrals to health education or preventive counseling services and programs. And at the patient's discretion, the clinician can give them advanced care planning recommendations as well. So we also want to review current opioid prescriptions and screen for potential use disorders. We know there's a lot of emphasis from Health and Human Services on identifying substance use disorders and assisting patients with those resources that they can use to overcome or cope or manage because of the negative impact on health potentially. So what happens after the you've conducted those first 2 different kinds, the Welcome to Medicare visit and then the first initial annual wellness visit? Well, what about the subsequent annual wellness visits? Because that's our 3rd kind of visit. It involves review and update of the health risk assessment that you created at the initial, and then update all the other components of the first annual wellness visit. However, the code is different, and want to be sure that we code it to be paid and avoid issues. If we include advanced care planning, then we can add the codes here. And remember that list that we looked at, all the quality measures, the MIPS quality measures that we can address by conducting the annual wellness visit. Don't forget to check out the codes that are listed on those quality measure sheets to help you with the coding. Another quick question. Can I bill for a Medicare annual wellness visit and a commercial insurance preventive visit for the same patient in the same year? Yes, you can do this if the patient has both as part of their covered benefits. Some patients have a commercial payer as their primary insurance and Medicare as their secondary.
It looks like there's a question in the chat.
Oh, okay. Let's see. Practices will often use codes like 99498, 99497, 1158F when advanced directives are discussed during AWV. Are you saying this is not allowed or billable? I'm not saying that. Let's see. Let me think about that and get back. Okay, great. I answered it. All right. Okay, great. Can you perform the annual wellness visit more than once? The initial, sorry, that's a key word. That gives away the answer right there. Can you perform the initial AWV more than once? No, it is a once in a lifetime benefit, the initial. Remember, there are 3 different kinds, so that the devil is in the details. Can advanced care planning ACP be billed separately? Yes. CPT 99497 and 99498. Okay. Can be billed separately as long as minimum time requirements are met. Use modifier -33 to avoid copay and deductible. Okay, so one of the things in our invitation to this webinar was how can practices really achieve the revenue benefits from conducting the annual wellness visit for as many patients as are eligible. So first thing I would say is please check with your MAC. Based on region and other factors, we want to make sure that we check with our Medicare contractor to make sure that we have the correct information and details or any questions about the coding and billing for these services. But according to information that I was able to see, the IPPE that's conducted for a patient who is newly eligible for Medicare, that visit can be billed at $168.68. And the initial visit, $173.70, and each subsequent visit, $117.71. So imagine that, let's just talk about the subsequent annual visits. Let's say you did those for 100 patients. That's $11,700 in revenue. And so it's important to really go through your patient records and see which patients are going to be eligible for Medicare soon, which ones are due for an annual wellness visit, and who can then have a subsequent annual wellness visit. And then, of course, if you add on the advanced care planning, then that's an additional revenue stream. And then if we remember how it connects with our MIPS quality measures and how all of that works together to impact our cost score, we see that this is an excellent way to address many of the reporting requirements and put your practice in a really good position. So what are some success tips that we can use to make this process successful? You really want to set a goal. Are you doing this in a way that you're just absolutely thrilled with, or would you like to make more of an impact in the number of annual wellness visits you conduct? So then set a goal and identify all the eligible patients who's attributed to your clinic that's now Medicare Part B beneficiaries, who has had an annual wellness visit. Create a target of the percentage of annual wellness visits you want to complete within the next 12 months. Break that down. How many do you have to do every week in order to meet your target for the year? This can be very easy depending on EHR templates that are already in use, or you can request that your EHR vendor actually help you to create a template to capture all the information that you need in order to identify patients who are eligible for the wellness visit, and then also keep track of the information that you need to document in order to keep track of all of this. So another thing is to reach out to patients. Some patients aren't quite sure what this is, but by explaining it to them and the benefits that they can achieve is also, and also the fact that there is no copay. You can provide this information through your patient portal, through an automated phone system, through many different avenues of outreach. And as mentioned earlier, some practices, because it does take a bit of time to gather all the information, some, in order to really focus on this, they designate specific time slots during the week or specific days during the week for these types of visits. And some practices have even chosen to have one eligible medical professional complete all visits, such as a care coordinator, rather than the patient's primary care providers. So there are all sorts of ways to incorporate it into the workflow and make it work for you. And so try to streamline the process as much as possible by doing pre-visit planning, utilizing non-physician staff, incorporating the EHR data that you already have on file, such as the family history and their list of medications that you can populate and pull together before the visit. You can also create a plan for an offline health risk assessment completion by sending it through the portal or another means, having it mailed to the patient and having them complete it and bring it back with them. Those are other options as well. So not as much is done actually in the office, but prior to. And again, we can also, if this is something that your EHR vendor will work with you on building out the templates for the annual wellness visit, then you can easily run reports on this information and update it. Oops. Yeah. So one thing that practices have also found helpful is to create a requirement checklist that includes the codes. So it's like a cheat sheet that they can just go down the list and actually printed one off. And if anybody wants access to that, I'd be happy to share it with you, send it to you. Just send me an email after the webinar and I'll be glad to share some of these resources with you. So everyone in the practice can get on board and have a share in making this successful. The scheduler would need to verify eligibility and which visit is the patient eligible for. And then the patient needs to complete the information, the list of the medications and providers and suppliers, and then bring all of that to their visit with them and complete their health risk assessment survey. And then the nurse and medical assistant can complete portions of it by taking height, weight measurements, blood pressure, and other things, and complete the Medicare covered preventive screenings and services form, flag concerns or questions for the provider. And also the provider then reviews the health risk assessment, addresses the patient's concerns, reviews Medicare covered preventive screenings and services form, completes the result and follow-up form and gives that to the patient, completes the written action plan with the patient and gives that to them as well. And again, we have a review of the codes for each one of these 3 visits. And so again, reporting a diagnosis code with the claim, even though you're not required to document a specific diagnosis, you can use the Z codes for general adult medical examination without normal findings.
Looks like there's another question in the chat and in the Q&A.
Ah, awesome. So that's why we recommend that you, okay, let me read the question so everyone can know. Is there a way to know if an AWV has already been completed for a patient? We have found after completing them that the AWV was completed by a different provider. All right. During the same year? That would be the question. I guess so, because then you would not be able to bill for it. That's why one of the recommendations, okay, I see, is to check with the MAC because they should have a record of what services the beneficiaries have already received. And so as part of your review of who is eligible, you should be able to get that information from them regarding a specific beneficiary as to whether they've had the annual wellness visit that year already or not. And I know that must be kind of frustrating to have that experience because sometimes the patient doesn't realize what they have had or haven't had. So thank you for asking that question. That's something to consider and include in our next presentation. Does anyone, oh, MAC? It is the Medicare, the one for Georgia is Palmetto. If you reach out to me, I can share that contact information with you. But they are who CMS contracts with to process all the payments, the billing for Medicare. Let me see if I can find that right quick. It's terrible to just Medicare Administrative Contractor. is a private healthcare insurer that has been awarded a geographic jurisdiction to process Medicare Part A and Part B medical claims or durable medical equipment claims for Medicare fee-for-service beneficiaries. So each region of the country has a designated contractor or Medicare Administrative Contractor, MAC, that processes the claims. And I'd be happy to, send you the information as to how to find out what your MAC is and how to contact them. CMS has a map that lists all the jurisdictions, and I can send you the link to that once I get, let's see if I can do that here. No, I don't want to disrupt my broadcast, so having a little trouble. Maybe I can do it here. Why can specialists do AWVs? That's a great question. I don't actually, oh, thank you so much. Thank you. Man, we have the most amazing community. Look at that. Thank you so much for helping us out with that. That is a good question. I had not come across the answer to that in my research, so I will look that up. Because I guess because some patients see their specialists more than they do their primary care providers. That is a great question. I guess because any physician can conduct it, and it's a great revenue stream. I have something in the questions. Can you send any forms that patients need to complete to help streamline the AWV? Yes, we will look at that as well. CMS also has those resources listed, and I will send you the link to the sample forms that they have, sample templates that they have for the AWV, the health risk assessment, and other forms. I really, really appreciate your questions, even though some of them I don't have an answer to. So when a PCP or primary care provider is penalized for the specialist doing the annual wellness visit, that is a glitch in the system. All righty. So if anyone has any additional questions, let me see if I have my contact information here on a slide that I can share with you. Here are some of the resources that were used that are available to pull together the information from this for this presentation. We also want to let you know that if you're interested in continuing education opportunities, that we can provide you with a 20% discount. I know every year we have to do the HIPAA training for our staff members and other courses around security, also courses for nurses and LPNs and RNs and PAs to continue their education, get their continuing education credits, and also front office staff. Lots and lots of courses, so many courses. We hope you check them out and utilize our discount. So here's my contact information. What I'm going to do is put my email address in the chat so that if you have additional questions or want to have a conversation around the support that we can provide for the quality payment program or anything else around health information technology, please feel free to reach out to me. I would love to be of service. So can pap smears, I think one of our slides said that those sorts of if there's an issue that's discovered that then requires a diagnostic test, it can be included, but there has to be a medical necessity. It's just not routinely a part of the annual wellness visit. Thank you so very much for joining us. We're actually done in less than an hour. And I appreciate each and every one of you so very much for joining us and for contributing your questions and for helping each other out. We really, really appreciate the privilege of being a source to support your success, because we appreciate so much what you all do for your patients and for each other each and every day. And so with that, have a wonderful rest of the day.